Hello, hello, Jared. Kanestantu, Garamahaget. Thank you. That is hello and welcome. Good day. My name is Erin Edwards, and um, I am so thrilled to have all of you fantastic folks tuning in with us tonight. This is episode 43 of Inspiring Insights. We're coming up onto our 52nd episode, which will be in no time, what it seems. Been doing this for almost a year now, so thank you. Thank you so much for all your support, and feel free to stay tuned for future episodes. We'll be keeping on going. And I just want to say before we get going on episode 43 tonight, I just want to say a special thanks to Rebecca Llewellyn at Your Divine Roots. She sponsored this episode, so you can check out Rebecca's work at yourdivineroots.com. And if you'd like to sponsor an episode, please reach out to me at hello@reawakenco.com. As I said, I had a little bit of Gaelic there at the beginning. Sorry I didn't mention that, but that was Gaelic that I was speaking. A little bit about me. I'm an uprooted Newfoundlander, and I have Irish and Welsh in my blood. I'm the offspring of two teachers, and I know that I have much to learn and much to step into my own teachings. Right now, I live in Toronto, and I guide soul-centered human transformation. I take up space here in a land that is and was tended by many nations, including Anishinaabe peoples, Chippewa peoples, Wendat, the Haudenosaunee, and more recently the Mississaugas of the Credit. And just want to say thank you so much for being on the land that you are in and for connecting a little bit more to your own divine roots. Now, I believe that podcasts have a lot of potential for healing. And this podcast has been amazing for my own healing, just listening to other people's stories. And I love our guest tonight. We went to school together, and I'm so happy to have her on. Dr. Yana Poulos. Welcome, Dr. Yana.
Hi, Erin.
Hi.
Erin is one of my favorite people in the world.
Oh my goodness. Thank you so much.
Do you want me to say hello in Russian? Здравствуйте.
Yes. Was that it?
Yeah.
Say it again.
I'm Russian. Здравствуйте.
Oh, I love it. I love having you here. So we're going to have a chat about health consumerism tonight and what it means to be a responsible health consumer in this world, in this day and age of, Instagram and Dr. Google and going to see holistic practitioners and naturopaths and a lot of other folks that are in the mainstream. What's the difference? We're going to talk a lot about a lot of different things tonight. So I'm happy that everyone's here. If you have any questions as we chat along, whether you're listening to this on our YouTube channel, please feel free to, type your questions into the comment section. I will reply. Even if you're out there in podcast land, feel free to shoot me an email, hello@reawakenco.com, and I can totally get back to you. I love hearing from everyone out there. So, Dr. Yana, I'm going to just read your biography, and then why don't we get into it?
Sure.
Amazing. Dr. Yana Poulos is passionate about supporting women of all shapes, sizes, nationalities, and sexual orientations. She believes women know their bodies and oftentimes exist in a healthcare paradigm that does not prioritize women's valid health concerns. She holds a special keen interest in PCOS, endometriosis, fertility, thyroid disorders, weight loss and weight gain, and menopausal conditions. Dr. Poulos is a graduate from the Canadian College of Naturopathic Medicine in Toronto, Ontario, with a Doctorate of Naturopathic Medicine. She started the CCNM Fertility Club and has been published in Naturopathic Doctor News and Review. She lives in Fenton, Michigan with her husband, 2 cats, and a multitude of fancy board games.
And a baby.
I wrote
that bio. You might hear her screaming.
That's totally okay. She might have a voice on this podcast at some point. And I want to mention as well, your clinic, Dr. Yana, you own Prima Wellness Clinic. So you can visit Dr. Yana's website, primawellnessclinic.com. Okay, Dr. Yana, so happy to have you here. I'm so intrigued with what you have to say. You've always been a woman of many words and much wisdom, and I appreciate everything you have to say. So maybe let's just start off, I just read your bio, but let's start off with like how you came to this to naturopathic medicine, where you are
Sure, yeah.
now. What brought you here?
Well, you know, I'm Russian, so I'm from Baku, Azerbaijan, and I grew up in an environment where you didn't have prescription drugs to do anything. Getting that kind of medicine uh, was not really available. And so I grew up with herbs and different botanicals and something simmering on the stove that my dad would strain and I would get, fed to, and that wasn't weird to me. Like, that's just what we did. Like, you put a poultice on something, you drank some botanical. We didn't really have tinctures, but I do remember we had valerian root. That was a very Russian remedy.
Oh, nice.
That was for like nervousness and irritability. And I just grew up with that. I was always interested in health, natural health, holistic health. Like, that was the terms that we used when I was kind of a teenager and in my early 20s. And I came to naturopathic medicine after I had been a professional actor and singer for like 10, 12 years. And I just was like, something's not right. I really think that I'm meant to be doing something else, either solely or in addition to what I'm doing, which was performing and teaching. My grandma was dying from congestive heart failure. And when we went to visit her in the hospital, they had just built a new integrative medicine wing that had naturopathic doctors. And I was like, what is this? I've never heard of this.
Wow.
They're doctors, but they work with herbs, I think. So I looked it up and I thought it was really scary because I saw the amount of schooling. And at that point I had zero science background. And I was like, this is too scary. I'm not doing it. So a year went by, my grandma passed away, and I looked back into it and was like, if I started a year ago, I would already be a year into this. So I started to shadow NDs. They became my mentors. I now work with some of them, which is amazing. They wrote my letters of recommendations. When I applied to CCNM, I did 2 years of prerequisites, did all of my science courses, and then went to CCNM, met amazing people like yourself. And that was it. And it was just like, this is what I'm supposed to be doing. Because I think that I bring a sort of practicality to it that I didn't think I would have, but it has really served me well. And maybe it's my like Midwestern roots where we're just so dang practical, and I can relate to people in that way. They're busy, they're tired, they just want to feel better. And actually, when I started school, I was a lot more, pardon the term, like crunchy granola,
Yes.
hippy dippy, like very, very intuitive, and that part just got kind of like honed down a little bit. So I can have that part, but also have okay, let me research this, let me read the articles, let me look at the science, and then kind of combine it all. So it's fun. I was just telling another ND today, I was like, we have such a fun job. It's great. I could see myself doing this forever. Like, when would I retire? I don't want to.
Oh, amazing. That's so good to
Yeah.
hear, Yana. Also because like you said, you were in acting and performing and singing for 12 years. So it's quite a change from that
Yeah.
industry, right?
Yes.
So
But the
cool.
person stays the same. There's a kind of like get after it quality. And I'm doing the same thing, only I'm a health detective.
Yes.
Like, instead of getting down into the root of a character, it's getting down to the patient sitting in front of me who's like, something feels wrong. What is it? I don't know. And that's when I have to go and find it.
Yeah. And the skill set, yeah, like you said, can be applied across multiple modalities.
Yeah,
I love
absolutely.
that.
Yeah.
I want to, you wanted to really speak on this topic, Dr. Yana,
Yeah.
and
Yeah.
I think it's so interesting because, we do kind of live, like I said, in a world full of noise. There's a lot going on, and it's hard to know, and it's different between, I think the ambiance or the atmosphere is maybe a little bit different even between Canada and the US because of
Yep.
our own healthcare system and how
Hmm.
it's, paid for basically by the government. So yeah, can we talk about that a little bit, like the hierarchy of healthcare and where that all kind of
Sure.
fits in terms of naturopathic medicine, but also just in terms
Sure.
of,
Yeah.
do I have to pay for something? Do I not?
Yeah. Yeah. In terms of US.
Yeah.
Yeah. Okay. So our healthcare is not government funded. It
Hmm.
is based on where you work. So there is lots of different insurances that you can, medical insurances that you can have. Okay.
Hmm.
So I'm on my husband's insurance. My daughter's on his insurance as well. And even with that, when I gave birth to her, like I had some complications and we got many bills,
Mm.
even when we have very good healthcare. Naturopathic medicine is not at all covered in any way. So just like in Canada, I think in Canada, you've got 5 provinces that are licensed. I don't remember off the top of my head how many states here because some just passed.
Yeah.
But Michigan, where I'm based, is not a licensed state. I act as a health consultant. So even though I went to school to become a primary care doctor, who's able to do all of the physical exams, who had internal rights in Ontario, I don't have any of that here. I do not touch my patients in any way. I don't perform any physical exams. I am very fortunate because I have a medical director, so I'm able to run labs under his guidance and license. And that's wonderful. Not many people can do that. And I also require them to have a primary care provider. So if they don't have one, I send them off to my colleagues. If they do have one, I always communicate via letter. And they don't know what an ND is. They think maybe I misspelled it, and so I've never really had any pushback though. So when a professional meets another professional, really the only thing that they care about is that the patient is safe. So as long as I'm acting in a safe manner and I can show that, and it really does start with that communication, with that letter. So you have this continuity of care. I don't have any problems. There's no they're not pulling rank on me in any way. Not that I would even expect that.
Nice.
So yeah, ND care not covered. Sometimes massage therapy can be covered if it's under a certain license. Sometimes chiropractic can be covered. I'm sorry, not license, insurance.
Yeah.
Sometimes chiropractic or physical therapy can be covered. But again, it's hit or miss. There's certainly like lower socioeconomic groups that are not covered in any way. Supplements, forget about it. They're not covered. Don't even think about it. So if you have a health concern, your choices are a pharmacological intervention or paying out of pocket.
Yeah.
And maybe that pharmacological intervention is covered. Maybe it's not. When I worked with a gastroenterologist, we did a bunch of SIBO testing, and rifaximin could be $1,000.
Wow.
And what are you going to do? Like,
Yeah.
that's what you do. That's what you take. And what do you do if you don't take that? Like, thank you for your visit. Bye-bye.
Right.
So there's a lot of kind of maneuvering that you have to do. And it's time consuming and it's stressful. And I'm not even the one, experiencing it. It's my patients. Right.
Right.
When they come to me, a lot of times they're like, you're my last hope. You're my only hope, Obi-Wan. you know, that's a Star Wars reference.
Snaps for the Star Wars.
What has my husband done to me?
Thank you, John.
So yeah, so that just tells me that this system is kind of broken. If they're coming to me, who's acting outside of the system, who's not even in the system whatsoever, and they're going, please, let me pay you out of pocket. I'm a cash-based practice. Let me pay you because I need this healthcare. I am sick and I've been to specialists and had surgery and there's nothing, and they come to me. And that's awesome because I get to see them, but it also makes me so upset and so mad for them. Like,
yeah,
why am I the one who's catching this? Like, why am I the safety net? You know, looking at your 12 different pharmaceutical drugs that you're taking that all do the same thing. Like, no one's monitoring that. You know, I'm shooting off letters like left and right because I can't change their prescription medication. So I'm trying to get everyone on the same page, on board.
right.
And why am I doing that when I don't enjoy any of the scope of practice in Michigan, you know?
Right. And like you said, it is, the model seems quite broken, right? Not only because it's not serving folks who can, you know, it's only serving folks who can afford it for one, or have the privilege, you know, of getting healthcare insurance. In that kind of model, in this broken system, like, I think the question is, how do we get patients, how do we give patients the best possible care?
Yeah. Yeah. So
it's not an easy question.
No, it's not. And I think the best way to do that is to approach it holistically, to approach it from many different angles. So we do our part as educators. So I educate my patients a lot on, you know, what their diagnosis might mean, because I can't diagnose in Michigan. That's a protected act. So if they do have a diagnosis or I suspect something, you know, I'm always communicating it with a medical doctor who is able to technically diagnose.
Yeah.
So like what that means, how they even get the diagnosis, like what kind of lab work requires to rule it in or rule it out, what kind of imaging, where I might come in to help with this diagnosis. And there's a lot of education, and that's very time consuming. It's one-on-one. You know, they have their own biases. They have their own level of comprehension. So I think in general, you know, it starts with having really good education in schools as to like even what your body is, you know, the countless of times I've had to explain like when you take a breath, your air doesn't go into your diaphragm, you know, or like explain your period to somebody or explain menopause to somebody. And you can like judge that. You can be like, how do you know this? But you know, how do you like, maybe you learned in 8th grade health, like maybe you just don't know, maybe these words you've never heard of, or maybe it's too scary, you don't want to look into it, you know, or maybe you're too sick to do your research. Right. So that's one. So I think just better health education in general, right?
Yeah, for sure.
And then also understanding how the medical system actually works. You know, who do you go to? Really, your MD, and in the States, a DO. So in Canada, you guys, your DO is not considered a medical doctor. Is that correct?
Correct. Yeah.
Yeah. And here, MD and DO, they're interchangeable.
So for folks listening, DO is Doctor of Osteopathic Medicine.
So they're kind of like the same as MDs, only they also do some spinal manipulations and physical manipulations. And they tend to be, maybe on the whole, maybe I'm generalizing, but they tend to be a little bit more integrative. But they still are following that flow chart, you know, medical flow chart. We all have those textbooks. It's like, do they have this? No. Okay. Do they have that? Yes. Do they have this? You know, and so on.
Yeah.
And they don't really exist outside of that diagnosis that they have to give. And they have to give it because otherwise the insurance doesn't recognize it. It doesn't recognize the consequent lab work or the imaging. It doesn't recognize the medicine that you're then prescribing, because you have to attach ICD-10 codes in order for them to keep track of it, right? So if they don't have that, if you exist outside of this flow chart, if your being can't be explained by a flow chart, you're out of luck a lot of the times. And that's when you Google holistic Dr. Michigan near me, and then I pop up.
And I'm just thinking, as you say that, Dr. Yana, you know, the lure of maybe self-diagnosing. If you know, if you go on Google, or even if you have a friend of a friend who knows about, you know, health, or is a personal trainer maybe, or et cetera, you know, this kind of, how do we kind of draw the line between what is practical and then how do
what
we
is
know
unsafe?
Yeah, when to go see a practitioner?
Yeah, that's a great question. And you're right. It's the lure of the self-diagnosis. And I don't blame them.
Yeah.
If you're feeling terrible and you're sick and you don't have the means, you know, to do anything but like scroll Instagram, like you're in pain or whatever, and somebody's like, hey, bad period, buy these supplements from PCOS Diva. Right. And they look beautiful, and you see it and you go, wow, like I have all of those things and I feel terrible and these cramps hurt real bad, and you buy it. Like I've bought worse from Amazon and Instagram at like 3 a.m., you know, like I'm up breastfeeding and I'm like, yeah, I need this. Like, and then my husband's like, what is this? I don't know, you know? So like that happens. And imagine if you're sick and in pain and it's been going on for years and your life is not your own anymore, right? It's like the illness has taken over. So I get it. But I think it's dangerous to do that for a couple of reasons. So one, chances are you lack medical knowledge. So what you might think is one thing, it might be another. You know, you don't know. Like the average person maybe has a basic amount of medical knowledge, and we go for 4 years to learn like in-depth medical knowledge, and then we're still like, wow, I feel like I know nothing about it, you know. And then we continue to learn, and the average person, they know even less than that, you know. So that's dangerous. So when maybe they know just enough to make a bad judgment call about what's going on. And then what I see happen is somebody latches onto a diagnosis that they have then identified for themselves. Mm-hmm. And they kind of exclude any other symptom that doesn't go along with that. And I think that's detrimental in the long run, because when they go finally to a practitioner, whoever they may be, MD, ND, whatever, you might be biased in how you present your case. You might say like all of these symptoms that maybe you don't really quite have, you know. And then I think it actually delays a true, accurate diagnosis in a lot of cases. And I see this all the time, because people come to me and they go, I have this. And I've had some really good mentors, medical doctor mentors, who are like, don't be fooled when somebody says that. Okay, you need to see it with your own eyes. You need to see that lab work. You need to see that imaging. You need to deconstruct whatever they just said to you, because they will throw words around that they don't know what it means, you know? And so whenever I hear that, it's like, I have to dismantle it. I have to get right down into it. And there's been many times when I'm like, you don't actually have the thing that you have. You have this. You know, you have something very different, or you don't quite have that, you know. Like I have the medical background and I have that ability to kind of dig down into it. And you may not, so don't do it.
Right.
And then the other thing is, yeah, like when you read my bio back to me is, yeah, I think people know their body, and especially women too, like, we have this like monthly kind of, hello body.
Reminder.
I am still here, I'm mad at you. And, and so I think we're a little bit more in tune with our bodies, because we do have that monthly reminder. So I think I want to tweak it a little bit, is that, when something's not quite right, but you may not know exactly what it is. And everybody, no matter how intuitive you are, no matter how much work you've done on yourself, where you're like, I know myself really, really well, you have blind spots.
Yeah.
Everyone does. Everyone has blind spots. And it takes somebody outside of you to be like, okay, well, what about this thing? And you go, I didn't even think about that. Everyone has them. And why would you want to miss that? It could be really important. You need that outside perspective. And that's what you pay for. You pay for that medical knowledge. You pay for that outside perspective, and you pay for someone to hold your hand through it and be like, this is what we're doing. Because the last thing a sick person wants to do is make decisions.
Yeah.
Because it's impossible.
Well, it's fatiguing as well. I mean, like, there's so many other things that, I mean, most of us are dealing with at least some level of burnout, most likely.
Yeah.
And it's just another decision that we don't want to make.
Right.
On top of all the decisions. Yeah. On top of like all the supplements that we bought at 3 a.m. off of Instagram.
I cannot tell you how many times I've had someone tell me a self-diagnosis.
Yeah.
And, as much as we're like a little ragging on like the medical establishment, like, I do think more often than not, you have these doctors that are amazing clinicians. They're incredible diagnosticians. Like, they will identify the thing, they'll run the correct tests, they'll send you off to the right specialist. Like, I have nothing but respect. And when in those few times somebody falls through the cracks, that's who I see. So it's very easy to be like, no one knows what they're doing. They all come to me. Yes. And it's not true. I see a very small portion of it. But I do see it. And, so, it's, sorry, what was my original point? I got worked up. I'm sorry. What was my original point?
I'm not sure where you were going there, but we were talking about supplements, maybe. Or...
Oh yeah. About how many people come and they bring like a treasure chest of supplements.
Yes. Yeah.
And I have to be like, who told you to take this? And they go, no one. I just thought I needed it.
Right.
Okay. Well, what else are you taking? And it's like, they could be taking 30 supplements, and that is very expensive, and eventually they get to a point where they go, I don't know what I'm doing. I don't know what's helping me.
Exactly.
I think that's a good transition to talk about supplements.
For sure. And I know that you wanted to talk about them anyway, because like you said, I think it's one of the most common questions that I got when I graduated. Same with you. You've mentioned, like, just friends of friends, family members saying, oh, I've been taking vitamin C, or like, what should I be taking for this?
Yeah. Or how do I know if it's good? Is this good for me?
Exactly.
When I told people I was doing this health podcast, and I said, well, what would you want to hear? And the first thing, every single person, 100% of the people I asked said, supplements. I want to know where I can get them. What should I be taking? How much of it, and, where I can get the best ones. And that's such a loaded, that could be its own podcast.
For sure. Yeah.
Tell a little bit about the Canadian supplement industry.
Sure. I don't actually practice as a naturopathic doctor here either. So I'm a little bit out of the loop, I have to admit. But the supplement industry in Canada is outside of the scope of the healthcare industry as well. So it's more
Yeah.
so just out of pocket payment.
Yeah.
And it ranges, right? I mean, I could go on Amazon and get a supplement from the US if I wanted.
Yeah.
And then also there are supplements here, and I know just from, going to school that there are a lot of different, almost like premium brands of supplements that are way more efficient. They also have like the proprietary blend of things in them that is, exactly shown in the research to have this component to make a change, right?
Yeah.
Versus a supplement you might get at, like, you can buy supplements at Dollarama here. I didn't even
Mhm.
know that. I saw them at Dollarama a couple days ago. And
Wow.
so
Did you buy
I'm
some?
wondering. Of course I did.
You
I
bought all
needed
of them.
some vitamin C. No, so so there is such a range, and I can only imagine what, people go to Costco all the time. All the time they're taking Costco fish oils. This was like the bane of my existence in my internship. And I'm
Yeah.
like, you're taking one of those, it's not doing anything for you. It's literally doing nothing for you
Just
because the
take it
dose
and
is
put
so
it in the
low.
toilet. Yeah.
Yeah. And so there's
What
all
I
kinds of
appreciate.
questions you need to ask yourself, right?
Yeah. Yeah.
Yeah.
What I appreciated about Canada was your supplement industry is very regulated.
Yeah, it is more
Each
protected.
each bottle has a lot number. In Canada, they are regulated as drugs, where in the US, they're regulated as food.
Mm,
So it's the Wild West here. You could put anything on a bottle.
wow.
And there's, when you say proprietary blend, that is the bane of my existence, because in Canada, if there's a proprietary blend, it's listed clearly about how much of each component is in that blend. What are the amounts and like the form. And here they could put proprietary blend, and then they just like list 30 botanicals, and
Oh,
good luck. Good luck. It could be, all of that proprietary blend is like the ginger in there because it's cheaper than the Angelica, and
right.
you don't know what you're taking. So that's the other thing. So I use pretty much only Canadian professional brands. I don't get all of them here through FullScript, which is my online dispensary. But I tend to use those. I will say that I do my very best that if somebody comes to me and they're like, look at my treasure chest of supplements, I look through all of them and I'm like, okay, you can take this one, but then I usually change the dosage. Consistently, people underdose.
Yeah.
And we know what the research says, like you said, that one capsule of fish oil is not doing anything for you. Just like put it into the toilet.
You might as
Um,
well.
yeah. And people find supplements expensive. They're like, okay, I'll just take one capsule of this, that was expensive. And it's not doing anything for you. So I like to dose. I wouldn't say it's aggressively, but I would say it's definitely like to the maximum of what the research shows for a particular botanical intervention.
Hmm.
And I get great results. I use good quality supplements that cost at a higher price point than what you would get at Dollarama.
Yeah.
But the difference is, so you have to look at, you're spending money for the safety, right? You're spending money for the fact that they were harvested in a certain way. What's in the supplements is the correct form of what you're using. It's not, it's not turmeric, it's curcumin, or it's a separate kind of proprietary modification of curcumin. It's, folate instead of folic acid. It's these correct forms so your body can assimilate it better. And the botanicals in there are at the dosage that they're supposed to be.
Hmm.
And the effectiveness is, basically from the practitioner finding what your actual problem is and then dosing appropriately. So when people say, is ashwagandha good for me? I just bought an ashwagandha coffee. Like, oh, no, it wasn't a coffee. It was an ashwagandha, like a liqueur. So they were trying, my friends just messaged me and was like, I'm, trying to drink less. Like, what about these adaptogen alcohols? And I was like, they sound fun, but what do you want to do with them? Like, if you wanted to dose it correctly for whatever ailment you wanted, like what diagnosis you're trying to do,
right?
Doing it in alcoholic cocktail form is not the best way of doing that. But it's out there and it's fun. And it's a word that like you've seen and you go adaptogen. Oh, I think I need to get some of those. I need to adapt.
Yeah. I think for a lot of folks, it's like, it makes them feel better that they're doing something.
They're like, I'm doing something for myself. I'm healthy, know? And so going back to so we talked about safety, the correct form, how it's harvested, how it's put together. Some botanicals are really finicky. And the effectiveness is you really are paying for somebody to accurately give you the correct thing to take that is going to make some sort of measurable change.
Yeah.
And you have to ask them, when I give somebody a recommendation for a supplement, I put everything that has to do with what they're taking. So why did I recommend this? What kind of change they're going to get? What is the dosage? What does the research say? How long they need to take it? What adverse effects they might have? What they have to watch out for? Do they take it with food, without? It's, it's a lot, right? And who's doing that for you if you are self-diagnosing and then taking a bottle for your irregular period, and it might not even be fixing the thing that's wrong? You're just wasting money. It makes me so sad for people. And I'm like, now I want to give you these supplements that are correct and I want you to get them, but you already bought $400 worth of supplements. So I guess let's use those up.
Right.
I feel really badly for people that just take something and it doesn't work because they didn't get the right diagnosis.
Yeah. And the thing is too, what I just thought of was, a lot of the supplements that you're recommending aren't actually available to the general public.
Right.
You have to get them through going to see someone.
Yeah. Yeah. And when you do see them like on eBay or Amazon, if you look at some of the papers that have looked at these supplements that are available online, they are adulterated.
Yes.
Most of the time.
So
that is very scary. Like, what are you taking?
Who actually knows? Yeah. It's basically you're just buying street drugs.
Yeah. Or sawdust. You're buying sawdust.
Oh, probably.
And that's very scary. Yeah.
Yeah. So in all of that, the safety, yes, I think that's top priority. And then, is it even effective for me with the thing that I'm trying to help?
Yeah. And that's the thing, for you.
Yeah.
For you as an individual, because, we can look at the research and we can say, oh, okay, like 2 grams of ginger in a capsule for nausea during pregnancy. Okay, there you go. Okay, you could give that to everyone. But it might not work for you, or it might need to be tweaked in a certain way. And only a practitioner who knows your case really, really well could do that and work with you on that, and finding that correct dosage for you that's informed by the evidence, but also takes into account the person that is sitting in front of me, because no one has done a randomized controlled trial of Aaron Edwards.
Right.
They should, but they haven't. And you might react in a completely unique way that requires like finesse and care to tweak those things.
Totally. And I mean, I see this even from just being a barista for years. There's certain types of people that just they can't drink coffee, right? They get jitters, they
Yeah.
get, heart palpitations, whatever. I can look at this person and say, oh, here's all the research, and give them tons and tons and tons of research on, how caffeine is great. And it doesn't matter because for that person,
Yeah.
you still have to take into account your own lived experience, right?
Yes, exactly. And I think that we're really missing that part in the Western medical paradigm,
Hmm.
where, it's, like I said, it's flow chart based. You hit these points and this is where you go.
Yeah.
And okay, this doesn't work. So okay, the next one down. This doesn't work, next one down. Oh, look, we're out of interventions, and they don't really look at anything else. And you know that's so important. I think what NDs really do well is that we really do see the forest for its trees. We see each individual tree and we go, look at the environment this tree is in, and look at the neighboring trees, and what is the soil sample right here. And
Yes.
but you're paying for that. You're paying for that time. That is a privilege that I have as an ND, that I can take an hour and a half with a patient and I could dig down deep into everything. Whereas a medical doctor has, 7 minutes with you, or 15 minutes,
Yeah.
and they do their best, and they have to be quick, and they have to, cross all the T's and dot all the I's. And a lot of times it works and it's great. And we're just here for the times when it doesn't.
Exactly. And I think that's
In a
why.
perfect world, it could be everything all together, right? We could all be together: physical therapists, chiropractors, Reiki, medical doctors, specialists at your call. Like, we could all be there in one big clinic, but we're not there yet.
Yeah. Yeah. And until then, it's hard to, because you want to make it as affordable as you can,
Yeah.
For, the most amount of people. So that's how I think we end up with these kind of generalized paradigms, right?
Yeah.
Of
And it's standardized, right? When you can
exactly.
standardize something, you can really look at the safety of that one particular way of doing something. It's quick. It's everyone knows it. You can teach it. You can synthesize it for everybody. And I understand,
Yeah.
like, that. I get why we have that. And for
100%.
emergency medicine, that's great. You hope that it's like that. You hope it's quick and they look at you and they go, this is wrong, and they fix it. And that's wonderful. And that's how it, I think, is the best example of how it should work.
Yes. Oh, for sure. And so, yeah, thank you for, kind of like fleshing out the supplement game a little bit more. I feel like, yeah, we could have you back again and just totally go into that further
Yes.
in front of a live audience. So I think that would be awesome.
Yeah. It was like reading a supplement label.
Yeah. And going
Right.
into it. Yeah.
Yeah.
In terms of the folks at home, Dr. Yana, I know a lot of people are still wondering about, okay, I'm going to go see this naturopath and I'm going to pay for that 90-minute appointment. What are the things that you might want to keep top of mind? I'm spending, who knows, anywhere from $200 to $400 probably.
Yeah.
In Canada here, it might be more or
Yeah.
less there, on one appointment. So like how can I really get the most out of that appointment?
Sure. Yeah, that's a great question. Because you're probably coming to somebody like me because something's not right and you've been sick for a while,
Mm-hmm.
and you're feeling vulnerable and exposed. So I tell my patients, when we first have like a little 15-minute complimentary phone call, and I always encourage people to take advantage of that, because there's many different practitioners and you just never know how you're going to gel with one.
Yeah.
So the way that it works with my clinic is we chat. I tell them about me. I tell them how everything kind of works in the clinic. And my intake is really long. It is really, really long. The thing that I tell patients is to be as honest as you can, as specific as you can. Again, don't self-diagnose what it is. Just say what it is that you're experiencing. If it's a rash, don't just mark rash. What is it? Tell me about it. Tell me about that weird thing that you don't think is a problem, that you like see spots in your vision, or that you get a headache every time you go out, and usually when you drink wine. And I want to know all of these things. I want to know what your environment is like, because that can be very affecting for the individual, especially if there's mold where you live. What is your occupation? I want to know all of those things that are in your life that make you you, that you may not think is important, but it is, because it might tie that picture together. Like I said, remember, you have blind spots. So you really want to present everything unfiltered to your practitioner. And that includes anything that's like embarrassing or uncomfortable. Like, I've heard it. Who cares? What are your hobbies? Like, what do you like to do? There's a like a little story. There was this guy who he like really loved playing the bagpipes. It's not a patient of mine. I like read this in a medical journal. This guy really liked playing the bagpipes. And he was Scottish. He like really got into it. And he was retired, and he was like, finally, I get to enjoy life playing the bagpipes. And he started to get really, really sick. And he was sick for like 3 years. And like, I think his bagpipes like broke, or he misplaced them or lost them, or they got stolen, and he got better. And what it was is that there was mold in the bagpipes. So the thing that he was loving doing and was like living for was making him sick. So I see this all the time with somebody's occupation. They have chronic fatigue syndrome, and it turns out that it all started when they started their painting company. Yeah. And they didn't wear a mask, and they didn't wear gloves, and they painted 7 houses, every month or every week or whatever it is. And they were exposed to all of these chemicals. I want to know all of those things. So even the embarrassing stuff, even the stuff that you don't think matters, put that in anyway. Hold on. I have a good list here. I don't want to miss anything here.
I know, because for me too, and it's cool to be educated a bit more in healthcare, because then it makes me a better patient, right? So I'm going with like my journal. I have a notepad.
Yes.
If I know that I'm going to forget the names, the terminology that people say, I'm like, I need to write that down. How do you spell it? And all these things.
And that brings me to another point. So, okay, in the intake, definitely if you're keeping notes about, like, let's say it's your bowel habits, right? Sometimes you get diarrhea, sometimes you get constipation. When does that happen? And you start keeping notes. I'm probably going to tell you to take notes after your visit, like in the intake, I'm going to be like, here's what you're going to keep track of. So if there's something that's going on with a certain chronicity, it's been a while, definitely take some notes on it. Just on the phone is fine, whatever. Any of that information can be helpful. And then in the visit, and I tell people, like, with me, with an MD, with a specialist, wherever you go, record that visit, because you will forget. You will forget. It'll be overwhelming. They'll say a word that you don't know. Like, it's stressful being in an office anyway, especially if you might get bad news. Record that visit so you always have it on hand, and then you can, play it for somebody or whatever it is.
Nice.
Yeah, definitely that. And I also think it's really important to clarify things that you don't know. Sometimes I get people who are very like eager to please. Like, they want me to know that they're educated on health stuff and natural things, and anything that I say, they're like, oh, of course, I've heard of it. And maybe that's true, maybe that's not. But if there's something you don't know, if it's physiology or biochemistry, or you hear a word you don't know, you got to say something. You have to, because you've just wasted that educational opportunity.
Right.
And it might never come back. You might forget it. You didn't record the visit.
Exactly. Or people
Yes.
have misunderstandings, or they go to the
All the
worst
time.
possible conclusion, right?
All the time.
So, I'm thinking lump in the chest, lump in the breast.
Yeah.
Of course, everyone's like, oh, breast cancer, but it could just be benign.
Yeah.
So
It could
you
be a
go in,
fibrocystic breast,
yeah,
and you don't know. And a lot of the times people, then they don't want to go, what I'm doing a lot of the times is explaining things to people, and it ends up being not as scary as they think it is.
exactly.
Sometimes I'll be like, okay, they're sending it for a biopsy because that is just what they do when they see anything that looks like anything. So don't worry. This is like they might like avoid going to the doctor because they know that they'll have to do a biopsy, and that's a really scary word. It sounds like cancer stuff. So I explain a lot of things, and I'm like, bring something from your other practitioners that you might not understand. Like, let's go through it. Let's go over it. And they usually have a lot of questions for somebody that has the time to talk them through it.
Yes.
I had a patient who had longstanding constipation for 30 years. She was doing enemas 3 times a week, and her doctor wanted to put her on Metamucil, which she took but didn't feel well taking it. Couldn't get the dosage right, and really she just needed a regular laxative that she was taking. But that was so scary to her. She didn't want the Metamucil. She liked natural things. She didn't want to take it. Her doctor was really dismissive, just like, what are you doing? Just take this Metamucil, and like left the room. That really leaves an imprint on somebody.
Yeah.
And so when we talked all about like how the digestive system works, how the bowels work, what types of laxatives there are, how to effectively take them, how to get the dosing right. And she has a bowel movement every day now. And truthfully, if she just took the Metamucil like with the regularity, and he talked her through it like I did, she wouldn't have come to me. She would be fine, right? But that wasn't the case. And it was 30 years of enemas, and
Yeah.
all because I had like the 90 minutes to talk to somebody about that.
Yeah, and it clears up a lot of questions. I think too, there's this piece of, can we talk about informed consent a little bit? Because I love it when a patient comes in and they're asking questions like, oh, how long do I actually have to be on this for? That's one question that no one ever asks. They think it's like for a lifetime, right?
Well, they come to me and I'm like, how long have you been taking it? And they're like, 9 years. Like,
Yeah.
you've been taking berberine for 9 years.
And so, yeah, there's like these questions about like, when do I have to come back and see you? When do I need to get a refill? How is it even diagnosed? Is this, like you said, is this the regular protocol, or is this out of the norm for me?
Exactly. So I actually have a little handout that I like to give to patients, and I wrote it down here. So informed consent. Okay, so what is that? It means that you have all of the information before you consent to a certain workup or treatment. So nobody really can do anything without your consent, unless there's kind of some outliers of like mental status, okay, or if it's an emergency. But if you are alert, awake, and who you are and who the president is or the prime minister, you are able to make these kinds of informed consent decisions. And you have to have all of this information before you do that. A lot of times when I see somebody going to a medical doctor, is that it's almost like implied consent. They just, or like a assumed consent.
Yes.
And
like this is the last word almost.
Yes, this is, well, like, this is it. Like, you have this and this is what you do. Or like, this is the test you need. And they don't understand why. They don't understand what the lab work has shown, you know, what did it rule in, rule out. Like, no one has really gone over it with them. And it was so different from how we were trained at school.
Mm-hmm.
You know, if you didn't talk about consent for that, like, castor oil pack that you recommended, you know, somebody was going to call you out, and Kono was going to come and kidnap you.
Yes.
Make fun of them because I'm in Michigan. Kono is the regulatory body of the naturopaths in Ontario. So I was like, this is really important. And as a patient, when I had care, I did not see this happen. Like medical, you know, seeing an MD, seeing somebody in a hospital or a clinic, like very rarely did I get this kind of informed consent, like roll call of things that they've ticked off in order to like do something to me, you know. So I thought it was really important. So I made a little handout and I give this to my patients. So basically, you as the patient can ask this of your doctor, and hopefully they go over it themselves, but at least you'll have this. So I would say the first thing would be is, what do you think is going on with me? And they might say, I don't know. We haven't looked at any lab work yet. So you can say, okay, what's your suspicion? What's your working diagnosis? What are you trying to rule in, rule out? Basically, like, what are you thinking right now is going on with me? Okay, that's kind of open-ended. So they might say, okay, you have irregular periods, you've got some hair on your chin, you've got acne, I think you have PCOS, polycystic ovarian syndrome. Okay, that's my working diagnosis. Okay, well, how is this diagnosed? So then they might say the Rotterdam criteria. Or, you know, they might say, we're going to test your hormones, or we'll do some imaging. We'll do a transvaginal ultrasound. You know, then they talk about how it's actually diagnosed. So, you know, if whatever comes back and it's not that, you can say that you've ruled this thing out. So at least you'll know what it's not. You might not know what it is, but you will know what it's not. Some diagnoses you can do clinically. So they can see you in the office and look at a rash, and they'll be like, I think it's this because of the way that this looks, because it's itchy, whatever, right? So how is this condition typically treated? What do you do for it? Do you cut it off? Do you medicate it? Is it steroids? Like, what is it? What are the side effects of this treatment? So what can I expect to happen? Maybe if I do it, would I get headaches? If I take Zofran, like they gave me while I was pregnant, because I was throwing up all day, every day, will it make me constipated? The answer is yes. You know, and you know what? No one told me. No one told me. No. I had to know this. Yeah. So, so what are the side effects of this treatment? And how long is this treatment? For rifaximin, we talked earlier about SIBO, you know, that drug that might have cost $1,000. You take it for like 14 days, okay? You don't take it for longer than that. You might repeat it again, but you don't take it for longer than that. So you need to know, and that counts for supplements too. Some of them you go on, you go off, like berberine, you don't take it for 9 years. You know, I dose berberine for SIBO, you know, for like 3 weeks. And yeah, so you don't take it for years, and you might not know that. When can I see the benefits? So if it's constipation, you know, you might see it that morning or in 2 days. If it's something with your hormones, with your period, you might see it in 3 cycles. What are my other treatment options? So can I take something for my SIBO that's not rifaximin? I don't have $1,000. What else can I take? If it's a medical doctor, they won't tell you anything botanical. They won't really tell you diet and lifestyle intervention. They might a little bit. Maybe that's not fair to say, but they might a little bit. But they're not dealing with botanical medicine or traditional Chinese medicine, of course. They're not dealing with any of that. So if you're looking for something like that, you need to go to somebody who's specifically knowledgeable about those things. So what are my other treatment options? What happens if I don't treat?
Yes.
Will this get worse and kill me? Will I get better? Will it just be annoying? What is it? What else can help with my diagnosis? And who else can help me with my diagnosis? What other practitioners? If they are like rolling their eyes and denigrating other practitioners to you, just run. It's like my biggest pet peeve. And truthfully, I haven't seen it happen very often. I've, had a lot of very amazing medical doctors who are like, hey, I don't know anything about herbs, but like you do. And like, that's important. We need that. And that's wonderful to see. So if they're like chiropractor, don't go see a chiropractor. Like, don't, just run away, go somewhere else.
It always helps to get a second opinion too, in general.
It does. And not many people do that, because think about what goes into trying to find another person, driving there, making the appointment, waiting. In the meantime, you're sick. And then finally, when should I have my follow-up? So do I even need to come in? When will I know that, this is all good? Do I have to retest anything? All of those things should really be discussed before anything is done.
Yeah, thank you for that, Dr. Yana. Those are really, really important questions. And I used to work as a birth doula, and so I would give my clients little question cards, like on almost like a business card, and just a few of those, just to ask, like, what's going to happen if I don't accept any treatment right at this second? Like, how long do I have to decide even?
Yeah.
And that's like a really good question to just have a conversation with your practitioner about.
Oh yeah, you're right. Like, how long do I have time to think about this?
Yeah.
Before it's gotten so bad that it's now an emergent and that I have to go to like the hospital for.
Exactly.
Yeah, that's a great point.
Yeah, those are really great questions. So write those down and bring those to your doctor's appointments. That's awesome.
Yeah.
Dr. Yana, we're nearing the end of the time here, and I want to make sure I get, you get to say everything you wanted to say. Is there anything on your mind at this moment that you wanted to share more of, or maybe something new?
I think in general, I think we need to be practical about how we approach our healthcare. A lot of times when we make these decisions where we buy these supplements off of Instagram, they're based out of boredom or fear, or they're like this quick kind of response to feeling uncomfortable in some way, or maybe also at the same time feeling seen. Like, this person shares my discomfort, they're also going through this, then I can take this and also feel good. Like, I understand that, but if you can take a second and kind of be practical about where you seek your information, making sure that somebody is licensed, making sure that you take that time to research them, look at their website, at their bio. I know you guys don't have like reviews. I don't know if you have like Rate My ND, but Americans love to review everything. So if you read reviews, take a second and try to look those up if they're available to you. Word of mouth is great, but I still think you need to do like your due diligence into exploring what kind of practitioner somebody is. And yeah, being practical and patient, and not being stuck in your own bias. So sometimes, since the people who come to me are like, they're very like natural and holistic and all of those words that I actually kind of hate. So they're all of those things, which is wonderful. But I think that they kind of almost tell it to me like they're telling me like a secret, like they think I'm going to be like, yeah, I hate pharmaceuticals and I hate doctors. And that's not true. Like, we need them. We need all of those. And a lot of times I'm counseling people to like, go get that test, go get that imaging, take that medication for your pinworms that you've had for a year. You can take 2 capsules of albendazole, but you want to come to me for a natural cure for pinworms? No. Like, that's ridiculous. Like, let's just talk about this. This could be over for you. So a lot of times I'm like sending them back and communicating with their medical team and just holding their hand through it. So don't be like stuck in your bias from it. Like, botanicals have their place, natural medicine has their place, energy medicine has their place, and medical doctors and emergency medicine also has its place in this. So just be reasonable, be practical, and don't try to pigeonhole yourself into like a paradigm way of thinking. In Russian, we have a saying, it's not going to translate well, but I'm going to try. But it's like, because it's cold in Russia. So it's something like freezing off your nose to spite your ears or spite your face. I think that's actually, have you heard that? I think that's, you guys also have a saying
it's
like that.
Kind of like, just being stubborn,
Yes.
like, right.
Yeah. And there should be really no ego with this. Like, we want to be healthy. We want our patients to be healthy. We want them to get the care that they get. So just kind of releasing that and being like, you know what, botanical medicine is great, traditional Chinese medicine is great, acupuncture, but I have this fungal infection and I need to take, a pharmacological intervention for it. And that's okay. No one is judging you for wanting to feel better. No one. And it's no one's business.
It's no one's business but yourself.
It's no one's business.
Yeah.
Get rid of those pinworms. What are you doing?
Oh my goodness. Amazing advice, Dr. Yana. Thank you so much.
I like that we ended on pinworms.
Well, it's a memorable word. So
yeah.
No, I have one more question before we end. And this is something I ask every one of my guests here on Inspiring Insights.
Okay.
And that is, what keeps you inspired?
Oh, I hadn't been inspired in a while because it felt like I just didn't have enough time to do anything well. I have almost a 10-month-old, and it was kind of rough, like touch and go there. But I would say it's getting new patients who come to me, and my old patients too, but it's really just the patients who come, and every case is like the most interesting book, and they're the ones that really inspire me because I can see that what I say matters, and that inspires me to be the best practitioner I can be. So like working on my own biases and reading the research when I have time, and doing all of this work to really make sure that they get the best care, because when they do, it's just a high,
Yeah.
Yeah.
It's like taking out a batch of warm cookies out of the oven.
Yes. Or like something that like just fits so perfectly.
Yes.
And those are the times like you live for them, and they're few and far between, but like the effort is so worth it. And each patient gets a piece of that, and like they feel it too, and you've like created something and you've made a difference. So yeah, it's like, it's really the patients that come to me, and like the more messed up the case, the more grungy the case, like the better it is.
Oh, you're such a detective, and I can
Yes.
feel the inspiration
Ooh.
coming from you, even through this virtual call here. So thank you so much, Dr. Yana Poulos, everyone. Um, so beautiful, so beautiful. Check her out. She's in Michigan, primawellnessclinic.com. That's PRIMA, wellnessclinic.com. And Dr. Yana, thanks again so much for being here.
Erin, thank you so much. You're amazing. Like you are so authentically yourself. Like you've whittled away the things that constrained you and that are not you. And I know how difficult that is. And I know that you're a constant work in progress, and you're constantly getting better. Each day is like the best Erin Edwards that you can get. So it's pretty cool.
Oh,
You're a
that's
pretty
so
cool
nice.
person.
I'm going to breathe that in as my
Yeah.
inspiration for the day. Thank you. And of course, yeah, my inspiration is hearing all of the lovely, practitioners and coaches and everything else everyone else that comes on here and shares their story, and even just the little bits and pieces, that makes a huge difference. Even if you're looking to go see somebody, if
Yeah.
someone out there watches one of these episodes and hears Dr. Yana speak, they
Yeah.
want to know what inspires you. They want to know what lights you up. They want to know that stuff. And I think that's really important. That's a whole part of healthcare. That's part
It
of
is.
part
Yeah.
of the reawakening journey.
Yeah. Yeah. Can I say one more thing?
Of course.
I am based in Michigan, but all of my appointments are all virtual now because of COVID, and I'm going to keep it. I like them.
Amazing. So you can
Yeah.
see anyone
Anyone
from anywhere.
from anywhere. Yep.
Oh, that is amazing. Fabulous.
I
Thank you
want to
so
get some
much.
Canadians.
Yes.
I love me some Canadians. I miss you guys.
We miss you. And you're not too far, but we'll get down to Michigan soon, I hope.
Yes. Yeah. That'd be wonderful.
Amazing. Okay, everyone, thank you so much for tuning in. This has been episode 43 of Inspiring Insights. Again, check us out. We have a podcast, and we're also on YouTube. Just type in Reawaken Co. Inspiring Insights. You'll find all of our episodes there, and everything that I do in the mindfulness train at reawakenco.podia.com. So thanks again, and have a lovely evening.
Thank you, Erin. Thanks, everybody.